for 4 days to clean up the unit, and then we came back. And there was some progress made, but the violations were still not addressed at that point. So immediately after that, I proceeded to send out the orders to vacate, and issue orders to condemn the unit, using a constable. So it was delivered via hand on the 22nd. And then we placarded it the same day. The occupant is unable to live there because you're not able to get inside the unit. And so at the moment, it's just still condemned. I thought it was appropriate to do so based off like what I observed. So there's different ways of usually condemning properties, through the housing code. I decided to use the emergency version without having to need to go to a board meeting and having a hearing. And through that process, I also consulted with the state. They recommended that we, it's not required by code, but they recommend that we bring it to the board meeting to, so you guys can, I can report it to you guys, and then also just acknowledge it to the public that this happened, and that's it.
So is there any resolution, further resolution on this, or is it still as much a disaster as it looks?
I don't think the conditions there have changed. I've been trying to get in contact with the occupant. They're not responsive to phone calls. I believe the different parties involved are also trying to reach out to them, and so they're not responsive to that either. I mean, there's different ways that this case can go from here on out. Maybe the owners can pursue eviction potentially, but it doesn't change for a longer period of time. But I'm not sure where it's gonna go. At the moment, the occupant just can't live there.
So you said there was some progress made. And was that, I'm just wondering if that progress, despite that progress, it was still, uninhabitable at that point?
Yes.
Or it was habitable, but they hadn't fully corrected it?
Yeah, so the three violations were like there's two egresses into the unit. At the first two inspections, they're both blocked, and then there's also just a massive amount of things in there, and there's pests coming out of the unit itself, plus odors. And at that third inspection on the 20th, they had cleared a pathway into the kitchen. But what they did was just remove the thing to put it into the hallway. So I'm not sure that that stuff was actually disposed of. That morning, the individual just took the stuff out, put it into the hallway, the common hallway instead.
Okay. All right, and does the occupant have a cell phone?
They do.
They do. So yes, it's possible they didn't, and that's why they're not responding to your calls, because they're not living there anymore.
Yeah, so I've been calling their cell phone.
And you said social work was involved,
Mhm.
so after that initial meeting, though, it sounds like maybe they aren't in contact with this person either.
They've come along on the inspections and have had conversations with the occupant, and they've also tried to reach out via phone, but they're not responsive. The belief is this occupant is living in their car or in the common hallways in the apartment complex.
How many units are in this complex?
I'm not sure. I think it's a couple of stories tall.
Also,
Yeah.
okay, so it's quite a few. And are any of the other people at risk because of that?
Potentially, I mean, there's like odors produced, there's pests, there's a fire load in there, those kind of reasons, but it's not like it's been like that since probably, last summer, I would say. Or this summer, but it's like last summer.
Right. You said social work's been involved, in this individual that is homeless, and you don't know anything about that. They shouldn't be living in their car. Have we at least offered, or so somebody's reached out to try to address the homelessness issue?
So that would be social work
Social work
question.
sounds like they've.
Yeah,
been
that'd be for
involved,
social
yeah.
work.
We can get that answer.
Okay, thank you.
It is, I think, as folks know, it's challenging to find shelter placements, and shelter placements are very restrictive in terms of you have to line up at a certain time. You may or may not.
I know, but we should just be making sure the efforts we made.
Yes.
Yeah, I believe they had that conversation with the occupant, offered, a placement into a homeless shelter, and the individual declined it. They've also been declining help from, like elder services and Springwell.
Oh, that should be like.
Can I, what are the next steps and the timeline? Because it sounds like something still needs to be done.
Yeah, so I believe the occupants.
Still concerns.
So it is a public
Passes and-
hearing, so the occupants can speak, if you are done sort of asking side questions, the occupants have an opportunity to speak.
Sure.
And the board's role is to determine whether the condemnation should be sustained or whether it would be overturned. As sort of Cy laid out, there are emergency powers that Public Health Division uses acting as your agent if there are situations that rise to certain criteria to sort of do an emergency condemnation. So it would be up to the board to determine whether that was appropriate and whether it wants to sustain that condemnation or whether it wants to overturn it.
Right, so are
So
you,
what was your question again, Rob?
I was just wondering, what are the next steps as far as the health department is concerned? It sounds like there's still some risk to potentially other.
Yeah,
units.
so there's like provisions in the housing code where, we can, correct the violations ourselves. But suggest not doing that because, and you collect the costs from that, from the responsible party. But there's a potential where that happens and then the conditions go back to how they originally were. So it just creates a cycle. And I have never done that before in the past. I've done that with, like clean and liens on the exterior properties, but not really, with owner occupied single family homes, but not really with rental properties. I'm not sure if that's appropriate in this case. And then outside of that, it'll be just following up once the violations are corrected to lift the condemnation.
It seems like the key to this is somebody has to help the occupant clean this up. And then you can lift the condemnation.
Exactly.
Doesn't mean we won't be back there again, but the fact is, we can't allow somebody going there right now the way it is. And putting other people in that building at risk.
Agreed, yeah.
and the landlord is obviously very involved in this as well.
I believe so, yes.
So this is a public hearing and we do have a gentleman here who'd
My
like.
name is Virgil Barber. I live in Needham Housing. In senior housing at that, and we've been having multiple problems there with mold. Black mold. I have pictures of it. I'd like to present to you. Go ahead.
Yeah, so this is an unrelated case, I think.
Oh, unrelated.
Yeah, it's not related to this.
It's not,
Yeah, we could talk separately about this. I think I had called you yesterday about.
you called me yesterday, yes, and I've been complaining about it for years,
Yeah,
and nothing has been done.
So it is a public hearing and people are able to make public comments. The chair can determine whether the comment is related to the matter at hand.
sure.
Okay, so I mean, you've come, thank you for coming. It'd be, if you'd like to make public comment, go for it. And,
Yes.
and if we could, I had mentioned this at the start, if you can aim for, less, up to 3 minutes, that would be great.
Okay.
Thank you.
I've been dealing with this problem, my wife and I, we had chronic, she has chronic asthma. I have COPD, now I just contracted, asthma myself. And we've been living in these conditions for years. And we've been addressing it to Needham Housing, which their head maintenance guy kept on telling them that it's mildew, but it's mold, black mold. Which I've taken pictures of it, and they still say it's mildew. So they really done nothing about it. They said, go in there and use bleach and kill it and stuff like that. But the proper way of doing it is tearing the wall up. This is what it looked like.
Okay.
That's on a wall.
This
Yes, that's
is
in my
Linden-
closet.
This is on Linden Street, is it not?
No, seabeds.
Oh, Seabeds.
Okay, and the last administrator, he went along with it and he said, okay, we're gonna have it cleaned out. They tore the wall apart and they were supposed to put a spacer in the wall. They did not do that. And when you're dealing with hazmat, you're supposed to tape the bag up and remove the tenant from the apartment. They did not do it that way there. You know, they just left me in the apartment. I just kept on getting sicker and sicker. Cause I had pneumonia at least 5 times now. And it's depleting my health and it's not good. Cause we're supposed to have good quality living. And it's not good quality living. And just because they're renovating the apartment, supposed to be building new buildings, they expect us to wait, but people are dying from it. You know, and it's ridiculous. They expect us to wait. We can't wait. So something's got to be done about it. Because I do have doctor's notes saying that it is mold that's causing the problem. I got these letters here from my doctor. And nothing's still being done about it. I spoke to Cheryl Gosman several times and she said, oh yeah, we'll move you out your apartment and we'll do something about it. They haven't done nothing yet. So this has been since September. Here we are in the spring. And pretty much she don't really know what she's doing.
So have you looked at this at all?
So this is yesterday was the first time I heard about this case. It was a case that was open in like 2022 when I looked through the files. So it was reported to me by the state because I think Virgil had contacted the state, so the state contacted me and was asking what was going on. I hadn't heard about the case, so I like looked back and I contacted Virgil through every single method possible. I think there was like 4 different phone numbers, I left voicemails and an email, and I think that's why he's.
I work at the VA, so it's kind of hard dealing with my phone
Yeah.
because you're constantly busy at the VA dealing with the patients there. But I got the message this morning and I called you and I heard about the meeting here, which I'm on the tenants committee and I don't see nobody here from the tenants committee. They just been dealing with Cheryl Gosman. I have to go over their heads because I went over her head. I went down to HUD itself and spoke to them, Federal Housing downtown Boston, to see what they can do. And they got on her about it. And then she gave me a commendation. Oh yeah, you went over my head. Okay, you spoke to my boss. Still nothing's been done. So my question is, who's sleeping with who, you know?
Yeah, so I'm happy to schedule an inspection with you because I've not seen.
Well, they
the
did
pictures or
an
like the-
inspection and I hope you did find the documents, but obviously you may not have. But they did say 100% mold.
I think we need to see it
Yep.
firsthand for the Board of Health.
Yeah.
And proceed from there.
Yeah.
This sounds intolerable.
We will, yeah, I think that would be the appropriate next step is for you to follow up and then we will close the loop with you on next steps once,
Pardon me?
we will let you know next steps once we've done this inspection.
Okay,
Yeah, so I could definitely call you on schedule that inspection, and then I could maybe provide like, any records we have based around that case that we have, like the inspection report from the past.
so what they did inspect, they said the air quality is bad in the place, in all the apartments. They have a fan in the bathroom, supposed to suck out the humidity out the bathroom. It doesn't do anything. You can use the toilet paper test, the toilet paper just drops on the floor. So that fan's not sucking out nothing. Then this woman, my neighbor, she had black mold growing on her ceiling. And they came in there and they put stain kill on it instead of cutting it out and removing it. She has cancer. You know, so they're not doing what they're supposed to do. And she had a rug in there for years and she has a bladder problem. So they just finally, removed that there. Cause they know something's coming down the pike. I'm getting tired of it,
So
and it's
we,
just making people really sick.
and we really appreciate that you came here today to tell us about this. So, we will definitely follow up. And, figure out the next steps, so it doesn't end up in a black hole somewhere. So, but
I appreciate it.
appreciate that you came.
We definitely don't want this to get lost.
Yeah.
Because, I've heard about mold issues. I thought it was down on the end of the chambers.
It's there too. It's in the whole complex.
Yeah.
Linden and Chambers, Seabeds, Linden Street. It's all over.
I think like yesterday afternoon was the first time I heard about this, so like I'm
Yeah.
kind of, I'm following up on it.
Okay.
Great.
And once you do follow up on it, I would like at least to have a discussion with you, or at least hear what your findings are even before the next meeting, because, a month is a long time from now, so. And
Yeah, with all the rain we've had, it's.
Yeah.
We can follow up with an update by email.
that would be great.
Thank you so much.
Thank you.
Thank you for coming.
Thank you for coming.
We do have the occupant of the current place as well. I wanna go and talk here, or would you like to go? Okay. Can you guys hear?
Good morning, my name is Joseph. The occupant of certain land and this side has been from my apartment. I suffer from OCD and, that's been the problem. With the collection. And what I find is that, when I'm under stressful situation, it exacerbates my OCD. And causes me to not process things the way that I should. I'm an avid recycler, so recycling is a mountain. And I had been working 2 security jobs full time, but a year ago, August, I suffered a 3rd stroke. And so I had to give up my other job, which was more hours. So I currently work part-time and, but I try to get as many hours as possible. Because of the, extreme inflation that we've been suffering for over a year and a half, I have to work as many hours as possible to have a half decent life. That's not an excuse, it's just an explanation. My company that I currently still work for, the 2 gentlemen who owned and operated Aegis Protection Security. They just recently retired. They sold the business to Live Nation. And so currently I'm security officer for Live Nation. The problem is that Live Nation is a national company which is monopolizing the music production industry. So that's caused me a little more stress and tension because I don't like working for them, but I have no choice actually because it's the only job I have right now. An added stressor is that a woman that I've been in a relationship with for almost 2 years, she has liver cancer and she's currently at Beth Israel Boston Deaconess. And they're trying to save her life because she's dying. So that, since Cy and the NHA was there last, I was supposed to clean out the apartment. I've been working, but it's been kind of not as quick as I would have wanted it to because of the stress of my life. Again, it's not an excuse, it's just an explanation. I'm here because I wanted to show that I'm not a person who just trying to ignore and flaunt the regulations. So then I was here to just explain this and then ask if I could just have a little more time to put it out. I've already received a legal notice from NHA's legal staff stating that I have a notice to quit. In 30 days, I'll have to surrender the apartment. And, I'm kind of hoping that they will give me the opportunity to clear it out and, show them that, I promise that I will get my OCD, get counseling and, get this, dealt with properly so that this does not happen again because, I'm 71 years old and I can't afford this extra stress. So that's all I'm asking for. Just please, yeah, just a little more time to get this done.
So, one thing that's important to note, and Sai, you can correct me if I'm wrong. NHA's process is separate from ours. So we don't necessarily have control over how they handle tenants. Certainly we can, try to encourage them to support their tenants, especially if their tenants are making a good faith effort to rectify the conditions that render the unit unsuitable for human habitation, but we don't have direct control over that part of the process.
And I think what we need to do is probably keep on their case and keep putting pressure on them. Obviously, in the end, it's their decisions because they're not even, well, they're a state agency.
So I guess my suggestion would be that we sustain or uphold the size order. And that the Public Health Division as well as the Aging Services Division try to work with the resident and with Springwell to clean out the unit. And we can also engage with the Needham Housing Authority and sort of show and demonstrate the progress. Maybe that would change their determination.
That makes sense.
I think that would be a good approach and you had mentioned 30 days was what you were hoping for in terms of a timeline. And you also mentioned that you'll be trying to seek the medical care that you need for the OCD.
I've been basically dealing with Kim in the hospital, trying to keep this straight, so. We both know that this could be a disastrous end, but, we're faithful. We should be loose, so we're just hoping that she's got good medical care. It's been a struggle with that because, medicine today is very different than it has been in the past. Everybody is a specialist, and nobody has time to have long appointments with people because there's so few. Anybody who's been trying to get a primary care physician, as Kim has been for over a year, finds that it's no go. She finally got PID down across from the post office, a medical building, then she got a primary care, and she hadn't been having, she got within, I think about 6 months. And constantly was telling me that she can't get the medicine that she needs to at least not have the pain that she gets from the pumps. And so then his office called and 2 months ago and said, we just got your blood work back, you've got to come in immediately. And I took it on, we went there, and his attitude had completely changed. She said, I was waiting, and they came out and said, can you take him to BID Chestnut Street immediately? And he said, of course I can. They said, they're waiting for her now. So we took her right back to BID Chestnut Street, and they were incredibly receptive, and they did a bunch of tests, and they said, she's gonna go right now to BID Boston. I said, well, I'll take her right down. He said, oh no, we've got an ambulance, it's gonna be taken down right now. So I followed the ambulance, and she's been there now. This is the end of the 3rd week.
Well, we are very sorry to hear about what you're going through and understand that you're explaining, not excusing, and so appreciate that as well. Tim, do you think as part of this process that we're going to initiate, we can also try to ensure that social services is in contact as well?
Absolutely, we can certainly do that. I guess I would, so we will, Public Health Division and Aging Services will work with Jess Moss, the Assistant Director for volunteers and counseling. Actually,
Has Springwell been involved?
I talked with, yes, a nice woman from Springwell.
Okay,
She's been trying to help me, and I've also been in contact with both, there's two Jessicas with needed social
Right.
services. They're very good also.
Okay, good.
excellent, thank you.
There's Jessica was on vacation with the kids for February. I believe she's back, but they're very good also, they're trying to.
Okay, thank you.
I appreciate that.
Yeah, and just to clarify what a condemnation means, it just means that the occupant can reside or live inside the unit, they still have the ability to go in and collect the belongings or clean it out, so. You can make progress over the next 30
What
days.
I've been trying to do is, I only have access to the apartment to try to clean up from 8 AM until 4 PM. Their maintenance hours, but there's no access on weekend. And, so I go by 7 o'clock, 7:15 every morning, and ask the gentleman to unlock the door, which they do. And, but then from 3:30 on, it's on. Because they're leaving at 4, so they won't.
Yeah, we need to try to get access after working hours.
Or on the weekends, yeah.
He's working.
Yeah,
Yeah, so-
maybe we can intervene on that.
Yeah, I can. You should have access to the unit throughout any time. Like you still have rights to the unit, so you could go
I
on the
was
weekends.
surprised when they told me that I couldn't have access.
Yeah,
I understand that if you decide I can't stay there overnight, I understand that. But,
But you need
you
access.
know,
Right.
if I'm not working on the weekend, then I have a lot of time where I can go, but no.
We'll work with you on that to make sure you have access. Yep.
So what I try to do then is try to get scheduled some weekend work. You know, and then working, 10 or 12 hour shift, so that I can't phone out the department, at least I make money.
So Cy will be following up with you to help with the access
It's a
issue.
difficult situation, I'm not making excuses, I'm just stating that this is the problem that we're not dealing with.
Yep.
And I wanted to just make it clear that I'm not trying to find any rules or regulations. No, it's a problem that I suffer from, and, while I'm living, I call today's time period living in a life, but I don't use that phrase affectionately at all. In the last 50 years, I'm kind of disappointed to see how life has changed so drastically. And, I've always been a very optimistic, upbeat person, and I still try to maintain that attitude. But I find that day by day, it's more and more difficult to do that, especially in trying to do that in this.
Madam Chair, we certainly appreciate you providing this information and coming here, and we look forward to working with you on this. I guess I would recommend that we close the hearing, the board take a vote on whether to sustain or overturn the condemnation order. And then the Public Health Division and the other parts of HHS will work to try to help resolve the situation.
And just to be clear, sustaining the condemnation, but allowing accommodation for
Access.
access.
And as a practical matter, do we have a way to stay in contact with the? A plan for communication, because I think that's
yeah.
really important.
maybe we could, exchange, I have a phone number for you. I keep on calling it and your voicemail box is not set up, so.
Sorry about that. I have a 3-year-old Android phone, and I've been trying to get a replacement for it. When it died, 3 months ago, I had insurance on it, they sent me a replacement. Unfortunately, they like to claim that they send you a new phone, but they're all reimbursed.
Yeah, maybe you could write it down for me and then
Sure.
I have that. And then other thing I wanted to just quickly mention is that like what compliance means to be able to to rescind the condemnation. And in my eyes, I think what that is like there should be pathways throughout the whole unit that are at least 3 to 4 feet wide, so someone could go
So I'd
through.
like to clean it so that.
So it's completely clean. Okay,
Yeah.
all right, so that's even better.
Afterwards, I want, you know, what it was, I want.
Okay.
So Tim, I agree with your recommendation. Let's close the hearing and so if you can connect and make sure you've got that contact information, and then you need a vote to.
Yeah, so someone, a board member would have to make a motion, potentially to sustain size, order. And then, we already have kind of the instruction you've given Public Health and Health and Human Services to try to.
Right.
Do you have a
To that
motion?
end, I'll make the motion that we sustain size order and that we work closely with Health and Human Services and the Housing Authority to grant access at times other than between 8 and 4,
Second,
especially on weekends.
Understood.
Okay, I will second that motion.
okay, all those in favor, Rob,
Yes.
Ed,
Yes.
Steve,
Yes.
me, yes.
Thank you very much.
Yeah, thank you.
Thank you for coming.
Let me to speak with us.
The next topic is train noises and quiet zones. So Julie and Kelly and Sai did the research, and you saw the information in the packet, including the slide deck. So they're gonna give a brief presentation, and then there is a member of the community who wanted to make a brief comment.
Great.
Sorry, you said we were gonna present first.
Yes.
Yeah.
Great. All right, I will get us started. So just first, some definitions from the Federal Railroad Administration, or FRA. Just so that we all sort of understand what is sort of, what are the regulations behind the train horn noise? So locomotive engineers are supposed to sound train horns for a minimum of 15, but maximum of 20 seconds in advance of all of these crossings. And whenever feasible, the train horns are supposed to follow a pattern of 2 long, 1 short, and 1 long horn sound. And that must continue to sound until the lead locomotive engine or train car occupies that crossing. Only local governments or public agencies can establish quiet zones, and they must be at least a half mile in length and have at least one of these public crossings. And Needham has 5 public and 1 private crossing. Every public grade crossing within a quiet zone must be equipped at minimum with standard safety measures such as flashing lights or gates. That can also include a constant warning time system, which basically just predicts based on the train speed when the train is going to get to the crossing, and then like starts to close the gates. And power out indicators, which indicates to train conductors when there's a power outage at a crossing. Public authorities have to implement these safety measures, but they can also implement supplemental safety measures or alternative safety measures in addition to these. And that can include things like eliminating a grade crossing entirely, installing traffic channelization devices, which are like, imagine those sort of vertical cones that appear in between lanes of a road. Or installing those 4 quadrant gates that come down on each side of a crossing. Basically, enough of these safety measures have to be installed within the proposed quiet zone so that the quiet zone's risk is at or below the FRA's threshold. In some circumstances, these extra safety measures are not required if that risk is at or below the threshold. Another option that communities can do is establish partial quiet zones, which restricts the horn sounding only between 10 p.m. and 7 a.m. In the next slide, we show the communities in Massachusetts that already have established quiet zones. So there are 28 of them, 24 of them apply to the MBTA, and those are indicated in bold. You'll notice that Beverly is listed here, I think 5 times. So that means that Beverly has 5 separate quiet zones. So that may be an instance similar to Needham, where there are, 1 or more stops, but there are, 6 total crossings that Needham has. And those may or may not be able to fall into 1 quiet zone or may need to be established as separate quiet zones. Next.
Okay, so there's four commuter rail stops, as we all know, there's Hershey, Needham Junction, Needham Center, and Needham Heights. So the grade crossings are really between Needham Heights and Needham Junction, I believe. And there are 6 major grade crossings, so like this is a map I think I pulled from FRA, so all the orange dots kind of represent grade crossings. The purple dots are tunnels where the rail line goes above the road, and then by the Hershey stop, there's another crossing that is not a grade crossing, but it's a tunnel where the train line goes underneath the road. And there's also a private crossing by the Needham Golf Club as well. So just to give you some numbers about the number of trips that go into town, so there's about 16 inbound and 17 outbound trips. A third of them are between the hours before or a third of them are before 7 a.m. and then or after 10 p.m. So those are like generally sleeping hours for some people. And then if we were to take the required amount of time and number of horn sounds required by FRA, there'll be approximately 50 minutes of actual audible horn sound every single day, plus almost 800 individual horns throughout every Sunday throughout the town as well. On the weekend, about half of the trips.
So there are relatively few studies that have been conducted on train noise specifically. The studies that have been conducted have showed impairments in sleep quality and sleep structure, as well as impairments to endothelial function. The vibrations from the trains also showed heart rate accelerations, but these are not as well understood. There was a statistically significant relationship between nighttime noise and diastolic blood pressure, with railway noise showing the strongest association. Additional studies have also been conducted on more general environmental noise. And these also showed increases in blood pressure, sleep disturbance, annoyance, anxiety, and hearing impairment.
So the risks, there's the risks associated with quiet zones are potentially trespassing risks that the FRA has identified. They believe there's data shows that 94% of rail-related deaths are at either at grade crossings, right-of-ways, which right-of-ways are the areas around trains that allows let's say for the MBTA to be able to go in and access the rail line, or attempted suicide. So the first two are generally more preventable. And using safety measures, they can be controlled in some way. And then grade crossings are the major safety measures that we would be controlling here if a quiet zone was created. Over an 8-year period between June of 2012 and May of 2018, out of the over 300 quiet zones, there were 190 trespass casualties. And then there were 86 beforehand and then 108 after the establishment of a quiet zone. And at grade crossings specifically, before quiet zone, there were about 23 casualties at grade crossings and then 48 after. So there was a over 100% increase in casualties from that.
Careful.
Hmm?
Because of that?
No.
We don't know if it's because of that. We know from one time to another time that a lot of other things happen to a tremendous number of confounders in this type of work. Yes.
Okay. Yeah, so the costs related to rail line trespassing includes that there are about 400 fatalities every year. In addition to that, there could be time delays and other unquantifiable economic and societal costs related to trespassing. And in Needham specifically, looking at the FRA reports, there were only 4 known collisions at grade crossings, and that they occurred in between 1975 and 1980. And yeah.
So there have been no collisions or incidents in Needham for 44 years.
I believe so.
That's the data we have.
So there is a difference to the FRA lists sort of all of their, what they're calling casualties, and some of those casualties also include, OSHA incidents, like, worker incidents on the railroads, and so we didn't include, or at least I think Sy didn't include those types of incidents there, because those are different than what we're looking at here. I want to add one note too on that, point about the trespass risk. Trespass risk going up 108.7%, that paper did sort of specifically call out that they didn't take into account the increase in rail traffic, increase in pedestrian traffic, auto traffic, increase in speeds of the trains or number of trains that were on those lines. So yeah, something to just keep in mind when you're talking about confounding factors. And then in the last sort of slide of data here, we put up accidents or incidents that specifically occurred on the MBTA lines. The table on the top is from 2017 to 2023. I did eliminate again those OSHA and worker related issues because it's not sort of the point of what we're discussing here. But it includes highway rail incidents, passengers injured, you know, the whole categories of passenger related incidents or train related incidents on the MBTA. And you can see that from 2017 to 2023. The table below that, I think, is a little bit more specific and pertinent to what we're discussing, which is incidents specifically at these highway crossings. Again, these just where the railway and the roadway meet at the same level. In Massachusetts towns, and the asterisks are the towns that have quiet zones established. I want to highlight that I don't know for sure that these are at quiet zones. So there may be instances where there are multiple crossings in a town, but there are only quiet zones established for some of those crossings. Beverly, we can probably assume did happen at a quiet zone because I think all of their crossings are in quiet zones. So those with asterisks have quiet zones, and that actually makes up the majority of those towns listed from 2019 to 2021. On the table to the right, also from 2019 to 2021, you can see sort of the user action that occurred in these incidents. So did someone go around the gates, stopped, and then went, didn't stop at all, or stopped on the crossing, which I just think gives some context to the choices people are making around these crossings.
When you say majority, I mean, I'm looking at these numbers. 7 occurred in towns that did not have a quiet zone. 8 occurred in towns with quiet zone. And so it's, yeah, it's really a wash. I mean, there's no statistical significance there at all.
Especially because we don't know if the incidents were.
And we don't
in the quiet
know,
zone.
yeah, we don't even know that, right?
Yeah.
So,
And that's a limitation in the data. But I think, you know, I think the charge from the board was in part because Lars and the folks who were very interested in this wanted the board to look into it and potentially take a position on the issue. Was, you know, are there health impacts of train noise? And I think there clearly are, although they're not 100% understood. Are there increased safety risks? And I think that is sort of an open question, but there's not a clearly conclusive answer to that kind of question.
And even the health impact studies are not
and the other,
conclusive in any way.
I don't know if you can slice and dice this anymore, but when you say highway user action, I mean, I think that's the most telling stuff that we've got here. You know, going around the gate, you're not gonna be able, I mean, that has nothing to do with warning signs. People were warned and they went around it anyway, right? Stopping on crossings, you're not supposed to stop on crossings, period, right? So, and that's, you know, what, 7 out of, 15 right there. So, I mean, the ones that I'm most interested in here did not stop, right? Didn't see a warning or something like that. Do we know where those happened? Those 3?
They didn't break those down by the location that they occurred, no. We may be able to look under the crossing ID or find more on those individual, because they're the same incidents that occurred in that.
Yeah, I mean, mind you, it's only 3, I get that, but, you know, that would be, probably the most interesting of those data.
Mhm.
But
But also, I think importantly, in Needham, we are starting from a very, very low number of incidents to start with. So, yes, the data is not clear about what happens when you go to quiet zones. Maybe there is some increased risk, but as Steve said, like, there's some things that you can't prevent, people going around the gate. I think train speed is probably one of the issues, but I don't think the trains are gonna be going any faster once these changes are made, if they're made. And that may be one of the reasons why we don't have that many incidents in Needham. It's pretty slow.
Yeah, when you see the train speed in Needham, even on the open parts of the track, it's practically nothing. When I lived out in the Midwest, we were on the main line from Cincinnati to Chicago for freight trains, and they would just roar through the town at 60 miles an hour. And weren't even in warnings on the crossings. Just talk about dangerous.
Yeah. So, why don't we go ahead and take our public comment, at this point?
Thank you. My name is Lars Onyem. I'm a town meeting member from Precinct F. A member of Safer, Quieter Needham that has been advocating for the town to explore this issue. I'm also on the Select Board's Quiet Zone Working Group, as we've been working to advance hopefully a town meeting warrant article to town meeting this spring to do the first step of this process, which is to study in a very technical way the possibility of implementing this. I just wanted to start by saying thank you. I came here a couple months ago to ask for the board to consider this topic. And frankly, when I saw this yesterday, I was blown away by the level of detail. I've been working on this for 3 years, trying to understand all these moving parts, and to see the amount of information that was put together in a very succinct way was very flattering and humbling, just because this is important to a lot of people. I'm an advocate, so of course I should be treated with skepticism at all times, and I appreciate that this board is taking the time to really dig into this. So I just wanted to acknowledge there's a lot of really good material here. There's the discussion the board's had, there's definitely some little nits and gnats on technicalities, and I'd love to provide some information which I can submit to Tim and his team. But it's like around the margins. This information I think is very succinct in what the impacts are. As I mentioned in June, 40% of Needham residents live within a half mile of a crossing here in town. And I'm happy to answer any questions if helpful. Just let you know, the Quiet Zone Working Group, we're putting forth and the Select Board obviously is ultimately the opponent, to study the 5 public grade crossings and go through the FRA's process. It's called the Diagnostic Team Review. It involves federal, state, and local participants in the whole process. That study will take several months at a minimum, and it would just be to figure out something. So one of the things I wanted to address in the report was we want to make sure we do something, and so that's what the working group is advocating for, is that something is done at every crossing. There was a mention of, you can do some things at some places and the average score gets low enough, but that's not where the working group's coming from. It's really trying to do something to make it more safe at every single crossing in town. And then the golf course is just more complicated, and it's can't be part of the official quiet zone process, and so it's gonna need to go through a separate process. It's gonna take, unfortunately, a little bit long. So thank you for letting me speak. I just wanted to say thank you to the team and to Tim and to all of you for this. It's again very humbling and appreciated, and I'm hopefully can contribute more to the discussion between now and April beyond. So I'm happy to answer any questions or anything else.
As part of the working group work, are you doing any sort of polling of the Needham residents about kind of their opinions about this issue?
We're not doing an official polling process. I don't know this for sure, but I believe the Select Board will be having a discussion about this as they consider moving forward the warrant article. I believe they'll have a discussion on this topic this coming Tuesday. And then there will be a subsequent, at least a discussion with the Finance Committee as well, because it's not cheap to do these safety measures. I'm not sure what their level of outreach or how they would do that, but we've been trying to advocate for just as much discussion and transparency on this as possible. Certainly you know, as I walk door to door around the neighborhoods, you know, talking to people, I mean, it's not for everyone. There are people are genuinely concerned for lots of reasons, cost, safety and the like, but, we hope we'll get more interaction.
And Julie, just curious if you or your team had any chance to even talk to people up in Beverly, because I just think they've got a lot of experience with this. Would it be worth seeing what the experience has been like for, you know, by talking to them?
Yeah, certainly we could. I think, yeah, I think it's always a great idea to go to the towns that have already established this. I do know, and maybe everyone sort of remembers, there were quite a few articles out about Beverly and quiet zones in general. Maybe it was last year because of, from that table, there were a couple of accidents in Beverly, and I believe one of them resulted in a fatality. And it brought a lot of attention to quiet zones and whether quiet zones that are established should be taken away. So I think that's a great idea to talk to them and figure out what their, because of course that got a lot of attention. We don't know what their experience has actually been.
The other thing that'd be interesting, obviously, is there's another option here, which is the partial, right?
Right.
Because if, you know, if most of the disturbance is during sleeping hours, and that's the majority of the health effect that we're seeing, you know, it'd be interesting to see whether or not most of these, you know, incidents, if they occur during those times, or during times when there's peak traffic across the crossings, which is gonna be during daylight hours, probably rather than during sleep hours.
But is it gonna cost any less
It
to do
won't
that?
cost less.
Because.
We have to
still
put
gonna
it
have to
crossing
put all
anyway,
the
yeah.
crossings anyway.
Right,
But
but
the
in terms
safety
of, but in terms of
perspective.
safety, you know,
Safety, yeah.
you might say, hey, you know, something that horns during the daylight hours, sure, you know, belt and
Definitely more
suspenders.
traffic.
Yeah.
Right,
For both ends.
it's not a cost issue, but it might be a
Yeah.
safety issue.
So, Tim, what does
So I
what does
think-
the board need to do at this point?
So I think the plan would be that the staff would do some additional work. We would have a fuller discussion with the newly elected board members in April. And the board could choose to take a position in advance of town meeting, which it's done on past issues like accessory dwelling units. When we do that historically, we focus on health impact, safety risk. We don't sort of get into, you know, it would be better to plant 2 trees and put up a swing set than this.
Yeah.
We just focus on those issues and why they make an impact. But I think that's one of the requests from Lars and the folks, but also I think from our next item on the citizens petition.
Again, I came to ask in response to conversations I had with fellow town meeting members last spring, which was essentially, you're saying this is better health and quality of life wise. What does the Board of Health say? And so just trying to fulfill that, not knowing where you would come out on the discussion, but just at least trying to honor that request of having the experts in town weigh in on it.
So I think that, I mean, the data we have seen so far, it seems to indicate, that there would be a positive effect on health. Specifically, definitely during sleeping hours, traditional sleeping hours. And the other thing we need to take into account is the MBTA housing initiative, that the state's mandating for the town, because the corridor along that where the committee is picking around all the MBTA stations extends from the junction right up to the heights. And we're gonna be increasing the population density right along that area, and that's where all the stops are. So we might wanna take that into account, think forward. And maybe do this, you know, sooner rather than later.
It's a safety issue as well as a health issue then,
Yeah.
because more people, more potential safety concerns as well. Okay, so it sounds like we'll bring this back.
Yep.
And, it might be a little more
Lars to
research,
come
but
back
yeah.
in April. Yep.
Okay.
If I may just add 2 things, to answer your question more fully. There was maybe not a ton of time for lots of outreach to happen between now and this town meeting for this study. But then again, that's a multi-month process and there will definitely be a lot of community engagement at that point.
Yeah, that makes
So I'm
sense.
sorry, I didn't say that well enough earlier. And then also, to the extent there's any help with cutting data or slicing and I can't tell you how many hours I've wasted doing that. So if I can be of assistance to just point to, I know you need to do your own research and work, but I'm happy to help shortcut getting to some of the information if helpful. Just any way to help, just get more transparency is great. So thank you very much.
Thank you.
Thanks for doing it.
Thank you.
And Julie, Sai, and Kaylee, thank you. That was an excellent presentation, so appreciate the research.
Thank you.
I will say that if you want to, I mean, I did a quick search of them when I saw this the other day. You search railway noise sleep. And I get 56 hits from the last 10 years alone, 75 total. So there's more than a little bit on this, you know. Now, some of those are not necessarily directly on point, obviously. But there's a lot of stuff there, and part of the problem with doing the research, I think, is a lot of it has to, you know, it's not just, you know, railway noise that affects, it's, you know, it's, you know, being in the flight path with Logan, right? And some days that's an issue noise as well. And, you know, other transportation noise, so you're gonna look at stuff that's like you look at stuff that's transportation noise that maybe isn't perfectly on point, but probably is relevant to us. Right, and that's just looking at like sleep effects. I didn't look at like vascular effects or what have you. I mean, those are separate surveys.
Yeah, we only chose sort of a small sampling to talk about, but the majority were on sleep impacts.
Okay, great. Let's move on to the citizens petition. Then we have some
Rob, do
guests.
you wanna come up to the table?
Welcome.
Thank you.
Don't mind introducing yourselves first.
Yeah, sure. So I'm Kathy Reyes. I've lived in Needham for about 11 years. I'm involved with a national organization called Beyond Plastics, which really focuses on trying to reduce plastic production and pollution in through legislation. And I've been involved with Green Needham for about 3 or 4 years. And last year we passed a plastic bag ban in town.
Yes, good morning. I'm Rob Fernandez. I'm a town meeting member, precinct G, so right nearby. Yeah, we met you all last year when we were working on the plastic bag petition. I first got involved with Green Needham about 5 or 6 years ago, specifically around looking to phase out plastic shopping bags. Initially, it was passed as a volunteer policy, and then last year it was passed at town meeting. Good to see you all.
And so I think the floor is yours, sort of.
Super. Well, I guess just based on, you know, information that continues to come out and reports on the dangers of producing plastic and then using it as consumer, and then the lack of proper ways to dispose of it or recycle it, we decided to move forward with kind of expanding a single-use plastic ban in town. And so we selected 5 specific items to sort of ban because they all have alternatives already available that are better for the environment. So the ban would be in 2 phases. Initially in January 1st, where we would look to ban polystyrene or styrofoam containers, plastic straws, unless they're specifically requested by patrons, plastic stirrers, and then splash guards for takeout cup lids. So like the little sticks that kind of go in to make sure that the hot liquid doesn't splash out. So that would be for the first phase. And then the second part of the phase, we would have take effect a year later, and that would ban single-use water bottles that are 1 liter or less from being sold in the town. And again, based on the research we've done and what we provided in our in the board materials, is that there are alternatives available to all of those items. And you know, we're not the only town or city that has done this, or there are many towns that have banned similar items. One thing that I didn't have time to add into the information we submitted that I pulled together and I'd like to share is just some recent reports and articles that have come out. I'm going to kind of pass those along on studies that, and I specifically kind of focused on water bottles because that seems to be sort of a higher threshold or difficulty for potentially retailers in town. But a study that came out in January shows that in a liter of bottled water, there can be up to 240,000 tiny pieces of plastic. Those are microplastics, and 90% of those were nanoplastics, so extremely small. Nanoplastics, we have learned, can affect every part of your body, including floating through the blood-brain barrier. Plastics have been found in every place in the human body that scientists and researchers have looked. Another study that came out just Wednesday of this week from the New England Journal of Medicine linked nanoplastics directly to heart attacks, stroke, and early death. The nanoplastics are literally clogging people's arteries, and so we feel it's a huge health issue. And we're hoping that we can get the Board of Health support in just really helping educate the members of our town and keeping everyone safe and moving away from single-use plastics.
And what, you said there's been more opposition to the bottles. Have you sort of gotten a sense from folks in the town or I guess vendors in the town about concerns around any of this?
So there have been a couple of more vocal vendors in town that are concerned about a loss of revenue based on this. As a result, we put out a survey that should be going out between today and tomorrow to all of the retailers in town to really understand how many of them are concerned about the impact. I've also been reaching out to other towns that have already passed a ban on this to see what the actual impact has been. And most retailers have been able to pivot. Again, we're not banning the sale of water. We're just banning the sale of water in plastic bottles. And
Yeah, it's just an example.
yeah, there are a lot of options coming about of water that's available in aluminum containers, which is much more recyclable, and also glass bottles as well. So we would hope that they would choose an alternative to that.
And the survey's being sent by the town's economic development manager now. So he's sending it out any day now.
And I would hope to have the results from that survey by next Friday, and would certainly be happy to share them.
And the cost of these versus the plastic, is it a similar cost? I actually haven't looked at this before, so I don't know.
It is a bit more because of the higher cost in packaging.
Could it be double what you pay for 6 plastic bottles?
Is it double? I'm not that's something that we need to do a bit more research on.
So I read this. My solution, my solution is, well, why don't we just simply put a refund, charge a deposit on the plastic water bottle, like we do soda bottles.
Right, and the state is working on doing that, having the bottle, a better bottle bill so that we can have people return them. But I mean, the truth is that plastic is extremely challenging to recycle. And even when it's recycled, we're learning that the recycled plastic is more toxic because of all the different chemicals that are involved in manufacturing it and giving it that flexibility. So, I mean, even when it's sitting, water is sitting in a plastic bottle, the chemicals leach in, and so it's concerning.
Tell me more about the splash guards and what the alternatives are there, because that's preventing a scalding risk.
Sure. So there are wooden alternatives to splash guards, but kind of the better alternative, and Starbucks offers, if you bring in your own container, they actually offer a 5 or 10 cent discount on that. And then, you can have whatever lid you want to prevent the
I'm assuming
splashing.
most people are not gonna bring in their own container, for better or for worse.
Yeah.
I mean, it'd be great if everybody did,
Yeah.
but you're out and about, you forgot your container, now you're there.
Yeah.
And, I mean, after McDonald's got sued, if you're not warning people that the coffee is hot,
Right.
it really is, but really is a scalding risk. And
Yeah.
that's what that's designed to prevent. So I just wanna make sure there's actually a reasonable alternative that's
mean-
gonna be offered.
So what we've seen is that there are like a wooden alternative similar to the stirs, that come in wood. And the other, I know that there are some lids that have like the closure, the flip top as well. but that's kind of all the research that I've done on that.
Okay, and then this is going to town meeting as a petition.
Exactly, citizens petition and for
Yeah.
the May town meeting, yeah.
And we spent a lot of time before preparing the petition, thinking about different options that should be included. We looked at other towns, we looked to Newton as far as other types of takeout packaging, and kind of felt that this was like a good list of items to kind of continue what was started last year with plastic shopping bags, but other potential single-use items that have alternatives. You know, we certainly are very sensitive to what, to the feedback that business owners will hopefully provide to us as part of the survey. But part of it was timing. In an ideal setting, we would have had that survey done before filing the petition. But because of the timing and needing to have it ready for town meeting, we needed to do it in this order. So we're certainly going to be very open to the feedback that comes from business owners. And I wanted to mention that.
So
But
Tim,
I would just say that one of their arguments is that, drinking water, that's a healthy option when people come into the store. And it's just not drinking it out of a plastic water bottle. So, just wanted to add that.
And there's certainly, yeah, go ahead.
No, good.
I was gonna say another argument that has been made about moving from plastic water bottles to aluminum, or having some kind of phase out of plastic water bottles is that it would encourage people to then purchase like a sugary drink, for example, or something different in the case. And what we're saying is that restaurant stores can still offer water for purchase. It's just in a different, more environmentally responsible container.
So is this the same path that we're talking about for the quiet zones in terms of if we can decide if we want to?
We would discuss more next month. I think town meeting will definitively want to know the position because in part the public health division is sort of the enforcing party. This would be a complaint based, well, it's just like the plastic bag, so they're not going out and conducting stings, underage checks on plastic bags. But if we do get complaints, we would follow up, we would go meet with the store owner, we would try to explain it, maybe there was confusion. If there wasn't confusion, then they'd get a fine. So it would be the same type of mechanism, which is, from our perspective, is not resource intensive.
Okay. So we will be discussing at our meeting in April, and then we'll decide if we want to submit a kind of official position from the Board of Health related to this.
That makes sense.
This is
Just a
great
question
information.
about, now that we're here about plastic shopping bags and the adoption, have you received any complaints at all from shoppers about stores that have not complied yet? Just out of curiosity.
We have not, so Sai is shaking his head, we have not.
Yeah, I guess I've
I
been
don't
here for
know
like
if that's
9 or 10
because-
months. I don't think I've gotten a single complaint about it.
So
That's
either
probably good
everyone's,
news, I guess.
everyone's complied or people haven't been upset that they haven't complied.
Yeah. Yeah, right now it's the phase-in, it's just the larger stores. It's come June, there'll be, all stores, so there might be.
You're starting to see the smaller stores pick up with paper a little bit here and there.
Is that right?
Yeah.
Great.
For the folks that are out and about shopping, tend to pay attention to it, I guess, and notice or not. So,
Yeah.
Exactly. It's part of it is the education process, which is kind of.
Just one quick question, so. Certainly it seems like there's some data about nanoplastics with the water bottles. Those aluminum containers, I don't know anything about how they're lined. Are they lined with plastic? Or, are we basically, if we ban water bottles, are we just taking care of one problem and then we create another problem that we didn't know about because now we're using aluminum water bottles, which we didn't use before? Have you come across anything related to health effects of aluminum or other water bottles?
I do believe that there potentially is a thin liner on aluminum water bottles. I guess, the overall impact is better. for instance, cardboard, the cardboard boxed water, that's not a good option, you know, for retailers to use because that has there's definitely several liners of plastic both on the outside and the inside of the container. So the best option is to encourage people to drink tap water because that has the most regulation, you know, associated with it as it's coming through the towns. But you know, if you're kind of ranking that, aluminum and glass are the better options.
And has there been any conversation in other towns, at least, about not just water bottles and plastic, but soda bottles? And I mean, there's lots of bottles that come in plastic. So starting with water, I can understand, but I'm just curious if it's broadened out at all.
So a lot of places on the Cape, it has broadened out to all plastic water bottles. We're finding that so many of the towns that are located on the coast are seeing plastic wash up on their shores all the time, and it's a huge issue. So they have much more stringent legislation that's getting passed. But again, we wanted to take baby steps, and that would be a huge slice out of our vendors and retailers.
Well, it's interesting timing about this New England Journal article that I'm looking at right now.
Oh, yeah,
Really
I
was.
saw that earlier this week.
Yeah.
Yeah, I did as well.
It's
It's interesting.
Yeah,
More.
it's more about plaque, it's about incorporation of plaques and plaque rupture. But, you know, again, it's one article,
I know.
Right.
right? So
Absolutely.
I need to see a little bit more.
There's an editorial accompanying that I'm gonna read, but.
That I haven't read. That's what I was looking for.
Yeah, there's an accompanying editorial, so I can send it around too.
Yeah, so I mean, you don't have to look very far to, you know, kind of find a lot of information that plastics are concerning, whether it's endocrine disruptors from the chemicals or, you know, the actual pieces of plastic itself, and the effects on climate change. I mean, it really is all encompassing, so.
Well, thank you for coming here, and we will deliberate at our next meeting and for sure let you know the result once we do that.
Excellent, thanks, and if there's anything else we can
Yeah.
provide for you, please let us know. I appreciate it.
Thank
Thank you.
Thank you.
Madam Chair, just very briefly, we put in a draft public license and fee schedule. You can actually see the track comments still in there. The proposal is not really to change much at all.
Yep.
We are going to do, and it should be done by the end of the fiscal year, a deep sort of analysis of how much time it takes on average to do with an inspection, a plan review, et cetera. So we would propose for the following year, we would have maybe potentially substantial changes, but right now we're looking sort of for most of the status quo and one or two clarifications.
Yep.
So we will, unless the board has strong feelings one way or the other, we will present that for vote at the April meeting.
Sounds good.
You don't need a vote now, right?
We don't need a vote now.
Okay.
We didn't advertise it as a subject on which we vote.
Yeah,
Which
it'd
would
just
not,
be useful to, you know, highlight the differences.
Yeah.
For the next one. I mean, there are very
There-
few, there are
The
about
track
5
teams in here,
maybe.
there's, yeah, very few.
brief budget update. I think I sent the board an email. So, Health and Human Services got 3.5 positions, 2 in public health, 1 in youth, a half position in aging that were recommended by the town manager, plus an additional half position that wasn't recommended by the town manager. The finance committee did cut at the end, the warrant article, which was the scientific expertise warrant article. Their rationale is that if there is a need for a study, we can go to them and they can do a reserve fund transfer. It's more of a philosophical question in their mind. They want to hold the money rather than having us hold the money. I do think there is some differences, just the nature of it, you know, I can't just say, okay, I'm coming to finance committee, I need a reserve fund transfer. I have, you know, steps and processes I need to go through within the town sort of bureaucracy. But I do think that if there was a pressing need, we would be able to get a reserve fund transfer fairly quickly. Yeah, they
Just not
also
in your
sort of,
control as much, so.
yes.
Yeah.
They also had given a lot, so I, you know, they weren't too interested in my arguments against that.
They
got the
have the authority to
epidemiology.
pull the warrant article. It's
Um,
not their article. They could disapprove of it.
That is, so that is true.
But they can't just pull an article. They don't have the authority to do that.
That's a good question. It's interesting, because they recommend the budget, obviously.
Correct, and they've been, you know, and when you go to town meeting, you know, select board approves, you know, finance committee disapproves, so
Yeah.
what have you, yeah.
That's true.
So I can ask about that. I imagine that given the negotiations that go on, that, you know, if
Yeah,
they
they may
say,
want to withdraw it.
Okay.
You know.
Somebody
that-
may have made a deal.
Yeah, yeah, that's up to, you know, did we propose that?
we proposed it, yes.
Right, so I mean, that could be the deal, is like, we'll be happy to withdraw it, you know, with this understanding, but I make sure it's ironclad, because I just see this delaying things significantly. You know, we have somebody come up, we need, you know, an expert. It takes a while to hire somebody anyway, so I understand this isn't like, you know, I need to have this today.
Yeah.
But if it takes 2 months to get the finance committee to act, you know, we have a need. It's the day after the finance committee had just met. Now we have to wait a month for them to do their thing, and then we have to wait another month for us to get together. I mean, that's a significant delay.
So I will talk to Katie King, the assistant town manager, or deputy town manager, sorry, and talk about sort of like how we would go about doing this if there was a need, and what sort of ways we can guarantee that it will go as quickly as possible.
Yep.
We do also have some ability, the public health division, well, Health and Human Services in general has a fairly large budget, so we can always sort of start the ball rolling with some, you know, unexpended, uncommitted funds. And then move the costs onto a transfer, or, you know, onto that account when.
Yeah, but if they have a reasonable process for getting this done, I mean, I have no objection to trying it their way. Particularly if, you know, it's a negotiation went that way, and then if it works, great. If it doesn't work, then we come back with a petition.
Sounds good.
Okay, moving on to staff updates. We are miraculously only 4 minutes behind. Let's try to keep these going, and let's start with shared services.
Good morning. Come up to the chair. Three things for us. First, the intermunicipal agreement continues to move. I'm grateful for the review from Needham Town Council. We are almost done. Tim and I had another meeting with Chris and are simply awaiting his final changes before we share it with the other towns. We think that we have a good process prepared for having it delivered to Dover, Sherborne, and Medfield. And I'm still holding my March 31st goal. I'm a little stubborn, so we'll see. And I'd like to have some incentives. So that's first. Second is that our regional health inspector did submit their resignation. Their last day is today. The needs for the position with their own needs, our scheduling things just didn't fit. So we will be posting that position. You will see that available. I know that multiple shared services arrangements are posting, so we will, I expect that there will be some competition for the position, but hopefully we can find somebody great to add to our team. And then lastly, I just want to acknowledge Kelly's contributions to the train noise study. Using our regional nursing capacity, we have a little extra time, so Kelly was able to participate with Cy and Julie and contribute some of the information. So that's all I have.
Great,
Thank you.
thank you.
Thank you.
Okay, environmental health.
All right, so I'll be giving the environmental health updates. So we're able to attend, Tara and I were able to attend MIHA Title V seminar in Tottenham, which was very, very informative. We were able to network with other health agents in the area. And then something we've been working on the last month, we had a Mass Call 3, we were able to join a Mass Call 3 monthly meeting where Cheryl Shabara kind of discussed some of the growing concern about like flavored tobacco products or potentially flavored tobacco products, including these Newport cigarettes that are not menthol but potentially contain characterizing flavor. This is something we're researching at the moment and might present to the board later on in the coming month or months. Also related to that, there's been a growing trend across the state about, hemp-derived, THC products that's kind of, infiltrating the retail establishments, in town plus across the state. Some of them contain like, Delta 8, THC variants, like in seltzer, that usually in seltzers or in gummies and edibles, and they're trying to sell them in stores just on the shelves. So, over the past month, I've gone to several of the stores, including this CBD store in town, that they were selling that, those kind of products, like just, the hemp-derived THC, so we had them pulled off the shelves. They're also selling, hemp-derived CBD edibles and drinks, so those are also something we're able to pull off the shelves. So we're just working through the legal nuances of that and, trying to enforce that in some way across the town. Another thing we're working on is we're trying to update our scoring, and fees according to, related to the food, safety excellence program that we had started out with. So we had, the initial scoring system that we had was like a 7-point deduction, and then 5-point deduction, a 7-point deduction for priority violations, a 5-point deduction for foundational violations, and like a 2-point deduction for cores. We found that that was too strict, like it was, the scores that were being outputted were very low, so we have already made that change in our program. And we found that the average has increased substantially to make it so like at least half of the establishments could pass our food inspection. So we're trying to like move that, change that up so it's, increases the average so more people can pass or get 90 or above, so they can get a certificate of excellence. So that's kind of, how we're kind of moving and with that. In addition to that, we have 2 other, moving on to plan reviews for like food permits. We had 2 restaurants that are planning on opening up this month. So one of them is the Common Room, which I was doing pre-operational inspections for. They're looking to open up, I think, this weekend on maybe Monday itself. And then Just Salad is also planning on opening in the month of March, probably the week after that. So mid-March, they'll be planning on opening up. They've like passed the pre-opening inspections. And they're just awaiting sign-offs. I think Just Salad is just waiting a sign-off from maybe the building department. But those are 2 places that might be opening up soon. See. Yeah, we got a decent number of nuisance complaints as well that I had follow-up on. Some of them were related to potential pest issues across the town, so I'm investigating that as well. The last month plus going into this month. And then yeah, I guess a lot was going on last month, so. Any other questions about like, I guess what was presented or not, or in the monthly report, let me know, I can answer them, I guess.
You definitely have had a busy month.
I do want to ask about the food scoring. This just smacks of great inflation. I mean, if it is too hard, it is too hard. I get that, but you know, you could either change the threshold for excellence. You could make it, you could do lots of different ways. You could say, you know, only 10% of the establishments in town are going to get this, and you know, cut it that way as a percentage. You could do it as a threshold. It's like you have to reach a certain score. But I'm a little bit concerned about dumbing it down and lowering standards just because people aren't hitting, you know, a scoring of excellence. You know, if they're not there, they're not there. I mean, part of the purpose of putting the food code was to improve the safety of the town. So, I mean, it's a yin and a yang here, I get that, and I don't know the details, but I do want to at least bring that up for discussion.
And it's currently a voluntary program, so I'm guessing part of what you're trying to do is incentivize people to actually go for it. Like if they feel like it's too hard to get there, they may just not even bother. Is that part of the?
So the scoring system, we're piloting this program right now. So like we took 3 months worth of inspectional data and then, look at the averages of like the scores and it was pretty low. So then,
Pretty low, meaning what exactly?
And
50, 40,
in the 60s,
60s?
yeah, maybe like, less than 10% would get a certificate of excellence. And after talking to like the economic development manager for the town, we want to make it so like it's kind of feasible to actually get the certificate of excellence. If only a handful of places are getting it, it's like, it wouldn't really mean anything, I would feel like.
Well, you know, is the point of this for economic development or is the point of this for health?
I think the point of it is for health, although we don't want to scare away or penalize the businesses as we work through the pilot project.
I don't think you're penal, you're not saying anybody's bad, but you're giving, certificates of excellence to, then I'm hearing about 10%. That would seem to be maybe about right.
Yeah. Yeah,
You
we don't want
wanna
it to make
give
it so
A's
that
to
it's easy to
everybody.
get it, right? We don't want to give A's to everybody, exactly.
Yeah.
And I think, making sure, so what I think we need to do is make sure people see what the path is to get to A. Very clearly, but I agree with you that we don't want to just give everybody A's and make it too easy. I mean, 60s is not where you want to be,
No, you always want to be at
if that's
least
the average,
75 or 80.
yeah.
Yeah, so I mean, I think there are a lot of ways to slice and dice it. That's a decision I don't think that we should be making as a board, that's micromanaging. But, I would just caution you not to lower our standards and not make this just about economic development. This is about encouraging people to raise the bar with their food safety. Clearly, there are some restaurants in town that are doing that job right now. So if some are, is there something we can do to get everybody else up to that bar?
We can talk definitely in a little bit more detail next month about it. I do think that I would characterize the people that we got to participate in, the restaurants we got to participate in our pilot as some of the better operators in town. So I think it was a little shocking even to us that places that, I would consider very good were getting, 63s.
So then then it is worth looking at our scoring as well.
Yeah.
Yeah.
If you've done a subset of your population and the subset was drawn from the best restaurants and they're scoring in the cities, well, then maybe that is Tom or something.
Yeah, but we'll bring back more information next month. We can talk in more depth about it. Because yes, we don't want to dumb down our standards.
Was the scoring system something that we developed on our own, or is that taken from other food excellence programs or?
Yeah, so the adjustment was taken from, I think we talked to 2 other towns that had tried a scoring system, and one of them dropped the scoring system because it didn't work for them, like this, due to their circumstances. The other one still has something, and then that was, I think, Westboro, and then we kind of used their kind of model somewhat. I think they got rid of the grading system, but they got like a pass or fail system going there. But we use their same, a similar numbering scale. But they started up with a higher number, like somewhat to what we did, and they had to slowly go down to a lower number to be able to pass more people over time. So like, they kind of went over the whole process that they went through, like the whole growing pains for a couple of years, and then it seems like we're going through that same process right now.
Could I add something quickly for just some perspective on this?
Sure.
It can be really difficult to encompass a single score into way the FDA is incorporating how they're categorizing their violations. And there are some restraints here. So one example I would give is with the original scoring system, you could have a hotel with multiple kitchens. They have 1 temperature violation in the whole establishment, that's 7 points. They have 1 spray bottle of sanitizer not labeled, that's another deduction. They automatically wouldn't get a certificate. If those were the only violations, I would say that's an incredibly good inspection. On the other end, because a cold holding violation can only count as one deduction overall. You could have a restaurant that doesn't have a single working refrigeration unit in the entire place, and that's only one 7-point deduction. So it can be really difficult to determine how you want to encompass, what the actual food safety looks like into a singular score. And I think that's why they're working on adjusting it now to try to find a balance.
Those are good points. Thank you.
Yeah, sort of think you have to weight it almost by like really the level of non-compliance, the importance of what they're being non-compliant about, et cetera. There's a lot of factors.
Yeah,
that need to
and another big consideration is just this, a size of the establishment, what sort of food processes they're doing. I mean, currently, you know, if you are just selling prepackaged foods, doing no cooking, cooling sort of thing, you know, versus your massive food establishment with a ton of staff, a ton of different spaces and a different food processes you're doing, it's really difficult to encompass that all into one score.
All right, well, it sounds like we'll have more conversation coming. April meeting's gonna be fun. All right. Let's move on to nursing.
So we concluded our AED scavenger hunt, and we did get a winner. We did get only about 11 entries, so we're gonna see how we can revamp it for warmer months, encourage people to walk around. The other thing I wanted to say is that we did have a little RSV cluster in one of our skilled nursing facilities. And what's interesting is none of the residents were vaccinated, and I'm not sure if the facility even offers the vaccine. It's a long-term care facility, so they live there. I'm not sure if people are able to go in to do the immunizations. I'm not sure why they weren't, none of them. But I guess they all experienced mild symptoms. It started with one resident, and then they either started rooming in together or they were kept isolated. But those are really just the big points I wanted to bring out.
It's a brand new vaccine
Yeah,
that we never cared about before, but now there's a lot of market.
right.
So, you know, maybe in the future, I'd be a little bit more worried about it when it's more readily available, but, you know, I have no idea what the costs are, who's covering it, or the like.
I think still now it's Medicare and Blue Cross. Yeah,
Is Medicare covering it?
thought so. They work, but if you have the criteria, which I don't see how they don't, but I don't know what their policies are. Yeah.
Is there a medical director for this facility? I assume
Oh,
there's.
Might be worth just chatting with them. They probably don't hear from us here. It's my guess.
And we have pretty frequently.
That's good, okay. That's good.
You know, because this could be a harbinger for something else, like if they're getting flu vaccines and COVID vaccines.
Yeah.
Right.
Yeah.
Other sort of public health.
Or how are they
measures, I guess.
keeping people separate when people are sick? You know, this-
You know, they start rooming them together. They start switching them around, is what they were telling me. I'm like, okay, so you got 2 RSV isolated over here. You got healthy people in the next room. How are you ensuring everything's okay? They do that with flu too, and they do that with COVID. So.
Yeah, and then what do they do about the ventilation system?
I think that's
Right.
much information helps too.
Okay, thank you. Epidemiology.
I don't have a ton of updates, that I feel like I need to go over. We had an additional biosafety permit that was reviewed and approved. And we're continuing to, improve upon our process every time that we meet, so, but it's been great. From a respiratory disease sort of perspective, I guess to shed additional light on the vaccinations, yeah, our COVID proportion, you know, COVID and flu vaccination is going up by, you know, maybe a 0.5% to 1% every time I'm presenting to you. So we've hit kind of a plateau there. The RSV vaccines, we actually have the numbers on that, which I think is interesting. And that actually went up by a couple hundred from last month to this month, which I do think is sort of interesting. And then the only other thing I really wanted to highlight was in the percent of hospital admissions and emergency department visits, this data from the state. You know, you can see that overall, the percent is decreasing, and for COVID, you can see a pretty noticeable decrease. RSV was always kind of low, but again, is following a decrease. Influenza does seem to be hanging on there, continuing on. And I don't know that that's necessarily so atypical of we're not completely out of flu season yet, but I think it's interesting to compare to the other respiratory viruses where we can see sort of a clear decline while flu has remained steady. Just something to note. Yeah, I'll have any other updates unless you have any questions.
All right, okay, thank you. Substance use prevention. Lydia's on, I see.
Good morning. Yes. So we just wanted to share an update about our strategic plan. I think we've been talking about it for the past several months, but we've been putting a lot of work in, and our regional partners have as well. Many of you know that our work is funded through the Massachusetts Department of Public Health, Bureau of Substance Addiction Services, and on January 25th this year, they gave approval to our regional strategic plan. And since then, we have scheduled a meeting for April 25th to review the finalized plan with our regional planning team, who have been involved in selecting the approved strategies. But we want to share with you today the 4 primary strategies that we will be implementing across Dedham, Needham, Walpole, and Westwood. And they include an adult social marketing campaign for parents and caregivers to reduce parent and guardian attitudes favorable towards youth alcohol use, 2 evidence-informed curricula, alcohol EDU for high schoolers, and Smart Talk Cannabis Prevention Awareness curriculum from Stanford University for middle schoolers. The goal of these programs is to address low perception of risk of harm among middle and high school students. And we'll also be implementing a positive community norms campaign to address community norms favorable towards youth use, increasing knowledge of actual use rates and positive behaviors of youth in the cluster. And our last strategy is a science-based restorative intervention for students caught violating school-based substance use policies to address a lack of consistent policies across the towns and in lack of consistent enforcement for substance use violations. Carol and I work with an evaluator who's working to create a synopsis of our plan to share at our meeting, and we'll be happy to bring copies of that document and share it when it's available, hopefully next month's meeting.
Great.
Thanks.
Questions? All right, thank you. Emergency management.
So I'm going to highlight 2 key items. First of all, we drafted the request for vendor. The second, we completed the storm ready application, and we submitted to National Weather Services. So next step, we are waiting to hear back from them, and they might send someone from them like to come here to walk through our emergency operations center, check our plans, and we take it from there. So this is the items. Yeah. If you have any questions.
No, looking forward to seeing what happens with the certification.
Yeah. Thank you.
Thank you. Okay, substance use prevention.
Good morning.
Good morning.
I will keep it brief. I would just like to highlight probably the 3 primary areas that we focused on this last month were our SPAN coalition activities. We now have our strategic plan, so we have our action teams going full steam ahead in terms of planning the activities that support the goals and objectives of the strategic plan. So our education team, for example, will be hosting a parent community education event in May that will be in person around substance use education, and then ways to support parents and caregivers with all of that information. And we'll have a couple of panelists to really help navigate that conversation with parents that evening. We're also working on an application to the alcohol policy academy that's offered through a branch of SAMHSA, and we hope that if we're accepted into that very competitive program, we'll be able to spend the next year in this national program. They're only accepting 14 coalitions nationally, so it's a fairly competitive application, but we'll keep you posted on the status of that. And then our peer recovery coaching services has really been going pretty strongly since the pilot started in January. Angie McDonald has been seeing a inflow of people reaching out to her directly, as well as a referral that came in from the police department last month. So last month, she had 3 direct contact people in the community who reached out to her to discuss peer coaching with them, as well as one from the police. So it is interesting. It is going to be interesting to see how, as Angie has gone about promoting the services in the community, where the different referrals will be coming in from, because she has been methodically doing presentations to both organizations in our community, such as the aging services and the police, as well as interfaith clergy, which is next week. So some of that obviously comes maybe directly from them, but then we had a wonderful article through the Needham Observer that Angie was highlighted in, and I actually included the link to that if you hadn't seen it. So we're really excited to see where this is going. And then lastly, our STOP grant offered tips last month, and we had a full capacity of 35 individuals who came to that training. That's maximum capacity for one tip certified trainer to provide an audience to. So we're also working with the police on planning a schedule for compliance checks this year. So more to come on that.
Very good.
Happy to answer any questions you might have.
And I'll just reinforce, I think the Needham Observer articles have been great to highlight work that's going on in this board and the activities. So thank you for that.
I'll second that.
Okay, accreditation.
Hi.
Hello.
So we've been really busy this month and working really hard. And yet there's not a whole lot that I can report to you. Just that we're making wonderful progress, really good progress. I'm feeling pretty optimistic about where we are. Thanks to Tiffany and to Allison Bodenheimer, we've actually made some really good steps toward identifying our action plans to meet the goals and objectives for a strategic plan and community health improvement. All of that within the context of performance management. You may have noticed that we have, or maybe not, that we have a new logo or a slightly modified logo for the Needham Public Health Division. And that has come from a branding project, branding strategy that has also been part of our accreditation effort. So it's not a huge change, but it is one that we're pretty happy with. And I think that's pretty much all I have to report. As always, I'll entertain questions.
Thank you. All right, and then last but not least.
Yep, traveling meals. She's on, okay, sorry.
I can't see.
I am mute. There we go. Hi.
Hello.
So another big month, 930 meals this month. I did want to answer some questions you guys had last month about the volunteers. So I pulled up averages. So for the entire month or for the entire week, each volunteer does about 8 clients per day, and they do about 5 stops per day. So the load on each volunteer, it's not too extreme. So I know you guys had some questions about putting too much on each of the volunteers. So I just wanted to kind of allay those fears you guys may have had. so 930 meals for February. We're up to 57 clients. We did have 4 new clients. 3 came from Springwell, 1 was private. We did have 6 people that did cancel, so we're down a little bit. I included some flyers in the bags about the taxi program at CAP, providing rides to medical program, not medical programs, medical appointments. And on the next page, you guys had questions about the COVID numbers possibly impacting. I'm jumping ahead. Let me calm down. All right. So there was a question about the big jump in numbers in January. So I looked at the numbers, and in December of 2022, we only added a net negative 1 person. And in January, we added 0 people of January 2023. Whereas in December of 2023, we added 8 people. And in January 2024, we added 3 people. So in that same time frame, instead of we added 11 people. So that's why there was that gigantic jump on the graph that you guys had a question about last month. And I feel bad, Tara, I didn't have those numbers, so I apologize for that. Okay, and then on the next page, Julie and I looked at the COVID numbers that you guys also had questions about. It appears that COVID had a little bit of an impact on the numbers, but what really impacted the 5-year average was fiscal year 19. It's just a really low number compared to the subsequent years, if you look at it. So I don't know if that answers any questions you guys might have about it. So I'm open to questions.
Then you have to go back before 19 to see whether or not that's a low year or no,
That was
that's
where
kind
we
of an
were.
average year.
Yeah.
Because I'm looking at, the raw numbers 19 to 24, and I think you've got an increase of like 60%. I mean, it's a huge increase. When you really look at it.
Yeah, I put the year-over-year changes percentage-wise at the bottom of table 1, just so you guys see there was such a huge increase from fiscal year 19 to fiscal year 20.
It's continuing to go up.
Yeah, it's still going
It's not
up.
just a COVID
Yeah.
thing.
Every month I see it go up, right?
Maybe graphing against the rate of inflation may also be interesting.
Yeah.
Because maybe just the food is just getting more expensive for everybody.
That could be a factor.
Yeah.
And Rebecca, I think for the volunteers, I think I had asked a question last time about like, if they find someone that needs 911 called or something like that, how do we just make sure they get a little support after? Because that can be kind of stressful to be in that kind of situation. So I think the answer was they do get that kind of support.
Yep, I check in with the volunteers. I check in with them after. I talk to them every week. If anybody has any issues, they know they can always come to me, and we definitely provide them those resources if they do need them.
Great.
Believe me, I want to make sure my volunteers are taken care of because this program will not run without them.
That's great.
Yeah, absolutely.
Okay, thank you.
You're welcome.
Thanks for doing that initial analysis. So Tim, other items?
Very briefly, next month is looking to be very, very busy. I was wondering if the board's available to do 8:30 to 11 instead of 9 to 11.
Yeah.
Or alternatively 9 to 11:30. I don't know if we need a full another hour, but it'd be helpful if we had a half an hour.
I can do either way.
I can do it either way.
I think I can do it.
Yeah, so right.
Okay, well, Rob, you get to decide, I think then.
I think I can do either way.
Cool. I guess, okay, maybe 8:30 then, be easier. to
8:30.
Probably better,
Yeah.
Okay. We will have a presentation about the Norfolk County Mosquito Control District. We'll have a new board member to orient. We'll have the policy discussions in advance of town meeting. The board will reorganize as it usually does before town meeting. And designation of agents. It's looking to be a packed agenda. and follow up from some of the issues this week as well.
I mean,
It's town election on the 9th.
do you think,
Yeah, it is.
do you think 30 minutes is enough? Not that I want to be in a 3-hour meeting necessarily, but
I think so. I think we'll try to trim where we can. Maybe if we think it's too long, we'll ask Dave Lawson from Norfolk County Mosquito Control to come in May.
Okay.
He comes every couple of years.
Yeah.
They do a very good job.
okay. Anything else?
Nothing else on my end.
I did see on the agenda, there is this certificate program, what is it, MAHB, Mass?
Mass Association of Health Boards.
Of
Yep.
Health Boards. So there's, I think the dates got sent out for when this certificate program is happening. So if any board members, I don't know if any of you have done this in the past.
I have done it in the past and
I'm gonna
on the
try
board
to.
on the
I am gonna try to get there this time, but if anyone else is interested, it sounded good. The other thing I would mention is I noticed in the Needham Community Ed, there's a program that I am also gonna try to sign up for. Steve, you obviously seem very knowledgeable about how the town works and what the town can and cannot do, but I am not. So there's a session NCE is doing on how Needham works. Town government for the people. And it is spend an evening learning about Needham's town government from a panel of town officials, including the town manager, a member of the select board, a school committee member, and chair of the planning board. Learn about structure, how decisions are made, the budget process, how you can participate, et cetera. So because I feel very ignorant, I am signing up for that too. It's March 20th, if anyone's interested, and it's free.
Okay, yeah, that sounds like a good program.
Yeah, I think it's with the League of Women Voters in collaboration with them. So
They do good job.
they do. So anyway, just FYI, even for any staff members who want to get a little deeper insight.
Yeah.
Anything else? Okay.
I just want to give a shout out to Lynn Chef because we've been at this accreditation thing for quite a while now and it's a horrendous process. And,
Thankless, yeah.
I think it'll be terrific when we are accredited and the Special Commission on Local and Regional Health recommended that local boards achieve, go for accreditation, so. Yes, I think we're gonna be right up there.
Thank you. Thanks, Ed.
All right. Motion to adjourn.
Motion to adjourn. Second.
All right, Stephen,
Yes.
Ed,
Yes.
Rob,
Yes.
me, yes.
Thank you.